Utah's Medicaid oversight has been critiqued for its lack of accountability and transparency, as a recent audit reveals systemic failures in governance and accountability. A comprehensive review highlighted that the state's Medicaid program, managed through the Office of the Inspector General, OIG, has struggled to uphold its mandate to monitor and prevent fraud. The audit, which spanned over 46 pages, found that leadership has not adequately addressed long-standing issues, including poor governance, inconsistent practices, and a lack of transparency in decision-making. This critique follows a 2018 audit that identified millions in uncollected Medicaid payments, underscoring the urgency of reform. The report states that the OIG's lax oversight has left Medicaid services unregulated, with the agency failing to implement critical recommendations from previous audits. Despite a budget exceeding $5 billion, the OIG's return on investment has been inconsistent, with an average of $1.10 returned per dollar invested since 2016. Auditors noted that 7 years after a 2018 audit, many of their proposed solutions, such as annual resource planning and standardized metrics, remain unaddressed. This delay raises questions about whether leadership has prioritized accountability over efficiency, leaving Utah vulnerable to financial risks. The audit also revealed alarming discrepancies in reporting, with data from 6 fields showing identical results in 2020 and 2021, raising concerns about accuracy. Annual reports retroactively reduced reported savings by $2.7 million without explanation, further complicating trust in the agency's findings. Critics argue that the OIG's failure to meet its promises highlights a broader systemic issue, a culture of complacency that undermines public confidence in Medicaid's integrity. The audit's recommendations include enhancing transparency, conducting regular performance reviews, and formalizing analyses to identify barriers to improvement. However, lawmakers have expressed skepticism about the OIG's ability to deliver results, questioning whether the agency's leadership is genuinely committed to the audit's conclusions urge lawmakers to consider policy alternatives, such as transferring oversight to another agency or dismantling the OIG entirely to ensure Medicaid sustainability. As the debate continues, the question remains, can Utah's Medicaid system rebuild trust? Or will its failures persist as a cautionary tale for other states? The audit's findings serve as a stark reminder that accountability and transparency are not just ideals, they are critical to the health of public programs.